Welcome back, everyone, to Legacy Years, the podcast, where we talk about all things related to aging, both the good and the bad. We try to offer insights, tips, stories, things that will help folks who are in this season of life. And today I'm excited to welcome Amandita Johnson to my podcast. And if you don't mind, just tell the folks a little bit about yourself and what you do, and then we'll get into this very unique, it's not a product, but information about this service that I'm excited to share with folks.
Absolutely. Thank you very much, Christy, for inviting me. It's been a pleasure being part of an educational programming for our clients and our society in general who really needs information, right? At that towards that end chapter of a person's life, their last 20, 30 years, and how can they make a quality of life that's, of course, worth living and fun.
All right.
I own CarePatrol of Northeast Dallas. It is a franchise that is present in the United States and Canada, and there are over 200 owners now. There used to be only 130 when I came in a few years ago,
Wow.
so I really enjoy the growth of this, but we help families find assisted living, independent living, memory care, or in-home care. And there are rare occasions where they need a hospice service or home health. So we're really a resource for the families, and we act as senior advisors. So I'm a certified senior advisor, just like you, and we have some knowledge of the different facets of an aging person's life.
Yeah, and that is true. We're both certified senior advisors. And on our little Dallas meeting this past month, you were talking about this program and that you're involved with it. And so I am so pleased that you agreed to be on the podcast today and to talk about this. So let's kind of get into what we're going to talk about. So you're involved in something that seems like a very special and relatively new program from what I can see called Medicare's Guide program. So can you kind of tell folks what that is and how you came to be involved?
Absolutely. So we are now doing home assessments for Continuum. It is a vendor of Medicare that provides and delivers the guide, what you call coordination of care and respite services for the families. So the guide program is only for families who has a patient or family member suffering from dementia. And as we know, the whole family suffers when someone has dementia at home, or even if they're in assisted living or memory care. So the guide program is multifaceted. Our part is doing the home assessments for the intake process. So before they can enroll, they must have Medicare Original or what we call Medicare Traditional. Okay. So if they have Medicare Advantage, they would not qualify for it, but they also need to have the diagnosis of dementia or a clear behavioral and symptoms of dementia if they have not been diagnosed. Through this, Continuum will offer a certain coordination of care services, which is the medical side of it. And then Medicare will also give $2,500 for the family so that they can stay as long as they want where they're at, most of them at home. So this $2,500 go into caregiving or custodial services, or it could be a stay at an assisted living. That is also a vendor of the guide program, which is not a very difficult process.
So what you're talking about, the $2,500, this is for the caregiver's respite. Is that correct?
That goes towards the care of the person who has dementia.
To give the caregiver a break? Is that
exactly.
Okay.
So let's just say a family member wants to go on a cruise. They haven't had a long vacation in 3 years, which is pretty normal because a lot of them who are very hands-on, either as a spouse or daughter or son, niece, grandkid, they tend to want to really be there for the family member because they have taken on this role, which is, frankly, a burden, right? It's an everyday burden to take care of somebody with dementia, although they wouldn't say that. There's an emotional toll, physical toll. There's a lot of it. It's really like taking care of a toddler in an adult form. What then happens when caregivers are burnt out is it then affects the care of the loved one. It affects their health. It also affects the person who has dementia. So when they go away, let's just say on a cruise for a week, they will tend to feel guilty if they just have someone from the family take over, right?
Yeah.
They were like, oh, I don't want to put this on my brother or sister. They can now use either an in-home caregiving non-medical custodial service agency, or they can use a care home that is licensed by the state where they're at, a memory care or an assisted living for that, let's just say a couple weeks, because a lot of them have minimum stays of 2 weeks, right? So that helps a lot because the average rate now for assisted living, let's say, is between 150 to 200 a day. So that can be pretty cumbersome when you multiply that by 7 or 14.
Yeah, I was curious if the 2,500 was enough to cover a 2 week stay or whatever
Mhm.
it is.
It can, it just depends. A
Okay.
licensed care home might only charge 120 a day. So that can be significant. That's, over 10 days. So it's enough for, let's just say a person just wants to go on a trip for 2 days to Fredericksburg or Oklahoma City and to see, a loved one or someone and just want to take a break. They can use that throughout the year,
Okay.
2 days here and 3 days here, which also helps them be more effective as a caregiver.
I was going to ask you that next. So I'm glad you clarified that. If
Mhm.
they could break it up. Is it an annual amount that they get, or is it a one and done type of program grant
It can
help?
be given, I believe. We are so new to this that we haven't really seen that end part of it. But I did see an Excel tracker or a worksheet where they can track, how many times this person. Um, I can almost see it as an account to where they can draw from.
Uh-huh.
But then they do have to show invoices and things like that to make sure that it is going to the right and for audit purposes as well.
Right. Yeah, and this is new, so bear with us
Mhm.
as we're,
Yeah.
all kind of getting used to the program. So, are there other coaching or educational components for resources for caregivers through this program?
Yes, the great part about it is the continuum of care not only measures the caregiver burden and deals with that. There's also there's access to nurses and what I call care coordinators, right? That will help them through this continuity, the continuum of care. I mean, so there is continuity for both the person suffering from dementia and the caregiver, because it really is a joint approach.
Right.
A person with dementia cannot manage their health on their own. They're going to need a guide. So as they are talking to a nurse, and a lot of these services are telehealth, because I mean, you and I know how hard it is to have to take somebody with
Yeah.
dementia to a clinic, seeing a lot of people and all that. That can be hard. That doesn't mean they can't, but
Right.
certain people with dementia it's pretty cumbersome for them, right? So this can be done through telehealth, and they'll have access to mental health practitioners and nurses and doctors as well.
So, how does this differ than like what they've been getting, the support and assistance that they've been getting from Medicare in the past? How is this different?
Right. So, first of all, this has never been done before. One thing I'm really passionate about is, of course, learning. But back in 2022 to 2023, I was doing some research from my doctoral studies about how to help people with dementia, right? And this was not called the guide program back then. It was just based on an act that has not even been passed. So in 2023, they passed the act that has to do with Alzheimer's care, and it was then approved in 2024. So to see this evolve from Medicare being just straightforward an insurance carrier, that's what they are. They do work with value based care as well, to where it is based on outcomes, not number of visits and things like that. But there hasn't been a real direct correlation between Medicare and supporting caregivers. So this is the first time that we've seen actual money going into families to help with that. And it is exciting, although it's small, right? I mean, there's a smaller percentage of people now that are under that original traditional Medicare.
Right.
But we're hoping it's a model that will also be followed by other carriers.
So I was going to ask you that if other
Mhm.
carriers have anything similar to this. So if you're not on original Medicare and you're on an Advantage plan, is there any outlet right now for those folks?
I have not really heard
Okay.
of it. It has to do with money, right? So there is a big pot that the government has now committed to helping families. But out of that pot, it is known that in just a 10-year time frame from 2025 and I guess by 2034, we as a country can save $21 billion um, of healthcare costs. And here's why. When you have a continuum of care guided, okay, so there's a difference between just using Medicare for help and medical services, and then there's a guided approach, a continuum of care that's being done that is now it's now a feeling of, as a caregiver, you're not on your own having to maneuver through this maze. There is now an entity that is telling you or helping you say, okay, the behaviors are this way. You're going to need to go back to your neurologist and ask these questions. Make sure the medications are on time and don't give this medication if this is So there's that guide that families have not had in the past. Now, every insurance carrier has a case manager of some sort, right? There's a disease management, there's case management, care coordination, and all that. But this is more formalized. So that's exciting. And it is also using private entities. We're not putting sort of as a nation, putting the burden on a government that has now have to go through that administrative process. So I really like the symbiosis between the government and private entities, such as Continuum, working together. And then people like in CarePatrol who are out there already visiting families and telling the families, here's this program. By the way, I can help you enroll.
Yeah.
I can do the assessment. We also have an assessment for the caregiver burden, and this can be done without the presence of the person suffering from dementia, because you don't want them to hear about those things.
Right.
Really having that honest conversation and finding out a way to help them. So it's, to me, it's just so exciting and powerful. Now, is it going to succeed? And I actually wrote a policy paper that's 25 pages long, and I wouldn't want anyone to suffer through that. But um, I pointed out some things, such as cooperation from family caregivers themselves, in really going through that paperwork, working with the people like in Continuum in doing that care coordination, because that takes commitment as well.
It does. And I think probably having someone to help navigate that is certainly beneficial for them because you're overwhelmed already
Hmm.
caring for your loved one. And to top it off, some of these programs, it's difficult to fill out all that paperwork and to do all those things that you need to get the assistance or even to know about the program
That's
and or
right.
programs that are out there. It is overwhelming.
It is.
Yeah.
Yeah, it is overwhelming. And, they might see this as, another paperwork burden, but that's what we're here for. We're just making it easier for families. I actually went through this process with a family already, and she wasn't sure if mom has Medicare Original or not. And there's a way for us to look into it to figure
Okay.
out if, okay, this Medicare number looks like, what is the color of the ID card? Is it red,
Got it.
white, or blue, or is it something else? So, yeah, they're not on their own at all.
Yeah, it's nice to know that they're not on their own. And for those of you out there struggling with this, you are not on your own. And there are people and resources out there to help you, like Amandita and her company. And this, I know, is something that's very near and dear to your heart
Mhm.
because you went through this as a caregiver and you know the struggle that comes with that.
Yes, we do have a family member who has dementia, and it's hard. I've seen it with my own eyes, and it can be so cumbersome and so confusing.
Yeah.
And and I'm also in the task force for Dementia Friendly Dallas, so I teach those lectures how to communicate with them, and it's really more of a discussion and presenting how we can be friendlier to those with dementia.
Yeah. So is that task force for those in the industry, or is it for the everyday person? What's that task force
So the dementia
designed?
friendly class is really a class for everyone,
Okay.
from kids all the way to adults and different professions. People with dementia are all over our society. They're in the stores, they're at banks and restaurants, and we have a great opportunity to get to really know how to communicate with them so that we can embrace them as part of our society, not put any stigma. So that is really a program to remove the stigma of dementia and how, we can support them better. A huge part of caregiving is really communication. I think, right? There's the physical side of it, there's the health side of it, but the everyday having to deal with mom making a sandwich or bathing them, redirecting, that's all about communication. And a lot of people don't really, first of all, understand what's happening in a human brain when they have dementia, because most of the time it's really not them, it's the disease.
Yeah.
So Dementia Friendly Dallas has a great way. It's scientific. It's backed by many years of research and dealing with people with dementia, and it is all over the world. Dementia Friendly program is present in dozens of countries now.
That's amazing. I didn't know that. I knew you were involved in that, but I wasn't quite sure
Yeah.
the semantics of it. So good to know.
Mhm.
And good to know about this program. I love that it focuses on helping people live independently as long as possible, because really, most people, their desire is to not have to go into a facility if they can help it. But again, they
Absolutely.
also don't want to be a burden on their family. So there's this catch 22, who knows they're going down that path,
Yeah.
deals with.
Yeah, and they can. There are nowadays, we have so much technology now that can allow people to be safe from what you put on doors, monitoring systems, fall prevention monitors. There's a lot of things that you can do, stove guards, to keep people at home, and be safe. At a certain point, it can be pretty expensive to
Yeah.
have to use a community assisted living or memory care monthly. And if they don't have long term care insurance, that's a huge financial burden on the family. So hopefully, this guide program is a bridge before they get to that.
Yeah.
To keep them at home as long and really to protect the caregivers, because it's been backed by many studies that caregivers continue to have health problems because of that burden of
Yeah.
caring for someone. It could be dementia, it could be anything, but caregiving is not an easy job. And hopefully, families will also understand each other, as they're
Yeah.
apart from their siblings or mom or dad who's caring for a loved one, that they really know that the day to day is not easy. So,
Yeah, it definitely is not. And I am so sad when I talk to someone who's going through something like this and they don't have other family. To me, I mean, like, your family is a great support system. So it's good to know there are other support systems out there that people can find resources and help and guidance and respite care, because I do think that's such an important one. People, we always say, take care of yourself, but nobody ever does.
no. No, and it can really be a big joke if I say that to someone, and if I don't walk their shoes, and even the type of dementia they have, it's not something that we can keep saying as a nation. These are the steps to combat burnout, and yet we don't
Yeah.
offer the right services or the right support. So this has been, if you look at the research from 2011 when the NAPA Act for Alzheimer's started through now, It has been, I mean, it's good news. It's been amazing. We're now putting billions of dollars in research and real tools to help families. So this is that real tool that will help families and hopefully will grow. We need it more. We need it more in the Medicare Advantage world. And I don't know at this point if there are plans to do that, because this is going to be, for one city will be millions of dollars,
Yeah.
right? So
Is this available nationwide?
a guide program is available in the United States.
Okay.
However, there are some zip codes that don't have presence yet.
Okay.
It's it has grown a lot. They piloted this in, if I'm not mistaken, in 2024. Whatever was the tail end of my study was in maybe 2023. So they've gone through that process and seen results. So now we're in that early phase of really expanding it. And
Yeah.
like I said, it's not hard for a community or a licensed care home to take advantage of this and apply for the program to be a guide provider. And we can even point them to how to do that.
Okay. Well, that's good to know. So, a couple of last questions for you. The first is, with your knowledge and expertise on this topic, which you have a lot of personal experience, educational experience, real world experience, what would be something that you would want a family member or a loved one to know if they're faced, like, what's the first thing you would tell them if they're facing having to be a caregiver for someone who's exhibiting signs of dementia?
I think the first step is really to know oneself. Is the max? I think and I've seen this, a lot of caregivers go day to day, just trying to survive, right? Trying to breathe. And I call it waterboarding, mental, emotional waterboarding, right? You're just drowning and then you come up for air. And when you come up for air, you feel that it's like the best day, but you have no idea how horrible your days have been because you've been in that hell for 2 years.
Mm-hmm.
So, what then happens is when they get that relief, that's when that sense of guilt happens because you've been so used to that suffering. So when you are faced with it in the very, very beginning, and in my case, I could be in a memory care setting for 3 hours and I have to get out of there. And I'm pretty normal for the most part, but that's the max, right? Because even though I've been trained physically, I'm taking in all of that pretending. I'm holding on to the ship. Is it falling, or whatever, drowning? And then another person is mad at you and you're redirecting that person. So 3 hours, right? If a family member is faced with it and they know for sure that they will not have the patience to deal with it, then they will have to either delegate that or understand, how many times do I need help in a week?
Yeah.
Because if you don't, I have seen family members who went before the person with dementia,
Mm.
heart attack, stroke. I mean, it's a very stressful situation. So I think that's the biggest thing. And everything else, meditating, doing yoga, whatever that makes people feel better, comes next.
I love that. Know thyself. So, if folks are listening today and they are looking for assistance, what's the best way for them to reach out to you? What can you help them with? How would you direct them with that? And also for Care Patrol services too. Let's give a little commercial for Care Patrol too.
Absolutely, yes. So, as mentioned, Care Patrol helps find the right, most appropriate place for care for a loved one at home. And if they want to know more about Guide Program, I think you could Google Guide Program CMS because they have a lot of discussions about the Guide Program there. But then each Care Patrol office may or may not be involved yet on the guide program. They can always contact me through CarePatrol of Northeast Dallas. If they
Okay.
Google that, and they'll see the phone number and website there.
Perfect. Well, thank you so much. I appreciate you
Thank
being
you.
on today. I'm glad that we were able to shed some light on this program, and I hope that it picks up steam with the other Medicare providers. I do think it would be so beneficial.
Absolutely. I really appreciate this time. We both are passionate and here for our elderly and seniors who need our help. So I just like to be around people who are honest and credible and always there to learn new things. And it's like, they said birds of the same feathers. It's like I feel like I could learn from every bird, right?
Right.
And it's such a great way to educate those who need us in like doing this podcast. I
Yeah.
really appreciate what you do. I've watched a couple of videos. I need to go watch some more.
Thank you. I appreciate that.
No problem.
All right. Bye.
Bye. Thank you.
Yes.